the 3 symptoms of Omicron that are different to other strains. But experts have warned that these are likely to be different in the Omicron variant, which has made its way to the UK in the last week. So far, 42 cases of the variant have been detected in the UK, and Dr. Jenny Harries, chief executive of UKHSA, said it is very likely more cases of the highly mutated strain Omicron will emerge. If you catch Omicron, or if you are a contact of someone who has caught it, then you have to isolate for 10 days, regardless of your vaccine status. But experts have said that Omicron could be hard to spot, as it might not be as obvious as previous strains. The NHS continues to say that a new persistent cough, a high temperature and a loss of taste and smell are the key symptoms of COVID-19. Professor Tim Spector, of King's College London and head of the ZOE Symptom Tracker app, has long called for the official symptom list to be updated, as he said COVID is now presenting as cold-like symptoms. Data from the app states that people who test positive now most commonly report a headache, runny nose, sore throat, and sneezing. But what are the 3 symptoms that have been mostly associated with Omicron? The doctor who first sounded the alarm about Omicron said she pushed for testing for a new strain, after young men that came to the clinic did not have the classic signs of COVID. Dr. Angelique Coetzee, a private practitioner and chair of the South African Medical Association, suggests the main symptoms of Omicron are. Dr. Coetzee described one very interesting case of a 6-year-old girl who had a temperature and a very high pulse rate. However, this is just one anecdotal case. The clinician, who is also on the Ministerial Advisory Committee on Vaccines, told Reuters that unlike the dominant Delta, so far patients have not reported loss of smell or taste. It's important that if you think you have COVID-19 that you get a test and isolate, as this will prevent more people from catching the bug. Experts globally are still trying to learn more about the bug, how transmissible it is, and how effective vaccines could be. Dr. Harries urged people to wear a mask in line with government guidance, which includes in shops and on public transport. She said, "It is very likely that we will find more cases over the coming days, as we are seeing in other countries globally, and as we increase case detection through focused contact tracing. That's why it's critical that anyone with COVID-19 symptoms isolates and gets a PCR test immediately."